had the opportunity to sit down with the YWCA, with Jesse Mandel, with Lynn Nilsson years ago to talk about an innovative program that was shown to truly change the outcomes, change the landscape, change the opportunities for for women who are struggling with this very, very severe and consequential mental health crises. And that was to provide funding for this tool that connects patients to care, that helps people understand that there were avenues to care, that helps circumvent this deep stigmatization that still plagues so much of our society with regard to mental health. And so I wish, there's no way that I could take credit for this. I got to be the conduit in funding to provide the program. The tool is up and running. It's phenomenal. We still have a ton of work to do. We have so much work to do, but I couldn't have done it without people like Representative Ray, who led the Appropriations Committee at the time and was one of my biggest champions in helping me support that funding request. And so again, it's an honor to be here to speak to the successes and how important and exciting this declaration from the governor is to continue to bring public awareness to this issue. But without the advocates, without the mothers, sisters, daughters, nieces, cousins, family members who are there on behalf of their own crises and the crises of their loved ones, this never would have been possible. And so I am grateful for the opportunity to say thank you to our community and to all of you who continue to do this work all day, every day. And congratulations to everyone. And we look forward to making more progress on this critical issue.
Good afternoon, everyone. My name is Rosemary Lesser, and I represent House District 10, which is Ogden and South Ogden, and I am delighted to be among all of you today. My background story is that 30 years ago, I arrived into Utah as an obstetrician gynecologist and have spent the last 3 decades of my life caring for women in this state. And what's clear to me is that you all have recognized, as I have as a clinician, how incredibly important maternal mental health is. The prevalence of postpartum depression that you see cited is almost always underreported. What I am working on as a legislator is extending postpartum coverage for women from beyond the current restriction of 60 days to 1 entire year, because Utah's own Maternal Mortality Commission has recognized that the postpartum period, and of course, as a physician, I certainly recognize this, the postpartum period does not end at 60 days, and the need for ongoing mental health support lasts for much longer than 60 days. And so my proposed legislation this coming session is to join 21 other states that have already made the move to extend postpartum Medicaid coverage for 1 year. This is so important. Women can't be dropped from coverage at the 60-day mark and expected to figure out what to do. Now, having said that, it's going to take all of us coming together, working in so many different realms to achieve this important goal of caring for all mothers in our state of Utah, and specifically as it relates to mental health. I applaud everyone who is doing this work. It's going to take all of us, and I look forward to hearing from the rest of the group today. Thank you so much.
Thank you so much, Representatives Daly, Vilmo, and Lesser. And now we will just appreciate so much all of the work you've done, and also want to recognize Senator Thatcher in the room and Representative Ray. Thank you so much for all of your work. Now we will hear from Ashley Finlay from Birth Workers Collective, Utah Black Birth Workers Collective.
Thank you. Again, my name is Ashley Finley, and I am here representing the Utah Black Birth Workers Collective. And they said that I have 3 minutes, so I'll do my best. I stand here just 4 days after 10 Black people were murdered in cold blood as they shopped for themselves, their families, and their community at a grocery store in Buffalo, New York. I stand before you, a Black woman and birth worker who worries about every single Black baby she helps into this terrifying, violent world, and about their mothers. Imagine how those Black mothers of those Black babies must feel. It stands to reason that Black maternal rates of postpartum depression and postpartum anxiety are at an all-time high when parents are forced to live in a constant state of terror for themselves, their families, and their children. So honestly, it seems trivial and condescending for me to stand here and talk about anything other than the root cause of the disparaging numbers surrounding Black maternal mental health, which is white supremacy. We cannot even begin to have this conversation until we make a true and furtive move to stamp out white supremacy in every system and institution, specifically in this state. It is beyond time to take a stand and show in real, tangible ways that the state knows that Black parents matter, Black babies matter, and that Black lives matter. Thank you.
Ashley. And now we will hear from Bon Mayes from the Utah Office of Health Equity. And Bon is on Zoom.
Thank you so much. Thank you so much to Ashley for her remarks as well. Good afternoon, everyone. My name is Bon Mayes. My pronouns are she, her, hers, and I am a health equity program specialist at the Utah Department of Health and Human Services Office of Health Equity. Today, I'm here to share with you the Embrace Project, a community-based research study developed in collaboration with the University of Utah Health's Wellness Bus, a high-risk obstetrician and researcher and their medical student research assistant at the University of Utah Health, and a cultural advisor. Our partnership also includes community health workers from the Utah Pacific Islander Health Coalition, National Tongan American Society, Project Success Coalition, Comunidad Materna in Utah, and the Utah Muslim Civic League. This study focuses on addressing maternal mortality and morbidity and diabetes health disparities among women in their childbearing years, 18 to 44 years old, before, after, or during pregnancy. This is done with our partners, specifically the Wellness Bus, who provides screening services and nutrition coaching by 2 registered dietitians at no cost, where self-care is integrated into these sessions. The study also includes Native Hawaiian and Pacific Islander, Black and African American, Hispanic and Latina, and refugee and New American women along Utah's Wasatch Front in Salt Lake, Weber, Davis, and Utah counties. A key part of Embrace is mental health and self-care for women to be able to allow them to thrive for their current and future generations. In our study of 155 women, 50% had a high screening score for depression. These screening scores were highest among refugee and New American women at 63%, and Native Hawaiian and Pacific Islander women at 53%. This is quite high in comparison to Utah women overall at 33.4%. Additionally, 19% of all women in this study screened high for anxiety. Among Native Hawaiian and Pacific Islander women, 23% had high screening scores. While these numbers are striking, it's important to thoughtfully and intentionally mobilize when we see these statistics. Compassion and empathy are crucial when addressing health disparities, as is understanding the cultural and historical context in affected communities. And we know that mental health may be stigmatized, and in many spaces, self-care is often seen through a narrow and inaccessible lens. In a previous analysis of 2015 to 2016 maternal deaths, Utah's Perinatal Mortality Review Committee found that 75% of Utah's postpartum maternal deaths were associated with a prior or current mental health condition. And one part of Embrace focuses on mental health and self-care that's rooted in Native Hawaiian and Pacific Islander cultural practices and beliefs, and reimagining and changing the narrative around what self-care should be. A participant in Embrace shared that they often feel that minority women are often overlooked or lost within healthcare systems. And after participating in Embrace, many others have shared that the Wellness Bus is a supportive and safe place that provides crucial and accessible health services in their communities. This study helps women to feel seen and heard, and we plan to wrap up around fall 2022. When women are supported in their mental and physical health, communities, cultures, and traditions are able to thrive. When women take care of themselves like they do for others, they create an environment where their family and community flourishes. And Embrace's meaning is simple: to meet women where they are and give them a moment of support so they can continue supporting others. Thank you for your time and this incredible opportunity to share the Embrace Project study during this Maternal Mental Health Awareness Month.
Thank you so much, Dawn. Now we will hear from Heather Dopp, co-chair of our Maternal Mental Health Policy Committee, chair of PSA Utah's Policy Committee, and a survivor mom. She will introduce our two survivor moms who are going to be speaking, as well as our final speaker.
Hi, everyone. My name is Heather Dopp, and I co-chair the Maternal Mental Health Policy Committee with Gabe. I'm here representing the Utah chapter of Postpartum Support International as a policy chair on the board of directors. We are elated to share the news of our National Maternal Mental Health Hotline. The Biden administration, combined with the efforts of many maternal mental health advocacy support organizations, survivor parents, and providers, granted Postpartum Support International the contract to run this hotline for expecting and new moms experiencing mental health challenges. Anyone who contacts the hotline will be offered a range of support, including brief interventions from trained counselors who are culturally and trauma-informed, as well as referrals to both community-based and telehealth providers as needed. Callers will also receive evidence-based information and referrals to support groups and other community resources. The hotline is accessible by phone or text at 1-833-9-HELP-4-MOMS. That number is 1-833-943-5746. This is available in English and Spanish and relay services. Now it is my pleasure to introduce to you two incredible survivor moms who will share their personal experiences with maternal mental illness. First, we will hear from Caitlin Blair, mother to one precious daughter, who we recognized at our annual Climb Out of the Darkness event last year. Then we are honored to hear from Summer Thatcher, Senator Thatcher's better half, who will share with us her experience with postpartum depression. Caitlin's on Zoom.
Thank you. Good afternoon. Just like it was said, my name is Caitlin Blair, and I am a survivor mom of postpartum anxiety and depression. The experience of suffering from this mental illness has forever changed me, and I'm grateful for the opportunity to share my story today. In October of 2019, my little daughter came into the world, and from the moment that she was born, I was extremely anxious about her well-being. And motherhood quickly became nothing like I was told it would be. For months, I was crying every day, multiple times a day. I would rage, want to throw things and punch walls, a level of anger I had never experienced before. I was easily irritated and I couldn't make even the smallest of decisions. I had terrifying, intrusive thoughts, and I would work myself into a panic over them. There's a quote by Karen Kleinman that says, "One of the worst parts about the symptoms of postpartum depression and anxiety is that they don't feel like symptoms. They feel like who you are." And I felt to my core, I was an angry, mean, lazy person that had failed. I was so embarrassed that I was struggling. I remember sobbing in my husband's arms one night, crying out, "No one sees me, no one hears me," over and over. I was completely hollow, hopeless, and invisible. I honestly felt there was no way out of my suffering but by being removed from the picture. It's still strange for me to say out loud that I almost died from a perinatal mood disorder. I suffered for 15 months, and over that period, I refused to take medication out of shame. And I reached out a few times to different providers, but each time I reached out, I didn't end up getting the help that I desperately needed. Finally, I decided to go see someone to get prescribed medication, and I was recommended to start therapy at a place that specialized in maternal mental health. I started taking medication, and within a week, I found immediate relief from the rage and persistent worry. I was given such a gift by my therapist and the women in my intensive outpatient program of really seeing me and hearing me. And what I felt was my final call for help was met with responsiveness and the intensity that my mental state required. I did 11 hours of therapy for 12 weeks, and it was hard, and I worked, and there were many times that I wanted to quit, but as I stuck with it, I slowly and surely started to find healing. And after months, I came home to myself again. There's a sort of calling that comes with knowing this darkness and finding the light again. It's as if I've been given this mantle to yell out into others' deepening abyss, this way to safety, this way to hope. It doesn't have to be like this. You will be well. If by sharing my story, I can help just one mom know that there is hope, light, and a life to live past all of the suffering, that they are a good person and parent for seeking support, and that they need not wait a minute longer to get help, then I will happily tell my story 100 times over. My earnest hope is that Utah continues to support and advocate for moms and parents like me. Thank you.
She looks on the back row. Hi, I'm Summer Thatcher. I am married to Senator Thatcher, and we spend a lot of time, do spend a lot of time in the mental health and suicide prevention space. And so my story is important because you can know a lot of things and still be vulnerable. So my story, when my son was born, he very quickly after his birth, he became very sick. His temperature dropped and his muscles started seizing up. And so the doctors jumped to the worst possible conclusion so that we would miss anything, and gave a pre-diagnosis of a meningitis. And so that following that went into a litany of tests and medication for 2 weeks. Fortunately, because I was breastfeeding, I was able to stay at the hospital throughout those 2 weeks at a little room down the hall with no windows that was big as a closet, but at least I was there and they let me stay there. Immediately after all this started happening, I moved immediately into a heightened state of adrenaline and just task oriented. I'm a military veteran. I was in the Navy for 8 years, and I'm very familiar with the going into deployment mode, going to work mode. But because of the awareness I have of mental health, I knew that that heightened state is not sustainable, and at some point there would come a down, and it wouldn't be pretty. But in that space, I was not able to recognize when that was happening. And my husband, who has, like I said, immense experience in this space, recognized it before I could and reached out to the social worker there at the hospital. Without me really realizing what was going on, they switched a lot of environmental exposures for my needs, and to the point of assigning me to color in a coloring book. And I knew enough of that with my experience that you just do whatever they tell you to do because they're the expert. So yes, I colored that coloring book. And that kid will have that coloring book for the rest of his life. And so I was able to work through that, fortunately, because of the care that was around me. Follow-on care, I'd say a big measure of my healing or my maintaining composure was that I was also directed to the Postpartum Support International. Yes, so I clicked into some of the support groups there, but also I made sure helped me maintain my own identity. So for me, it was rebuilding a Jeep Cherokee 2001 Sport. That's me, that's my thing. So fortunately, while I had all these elements with the child that I didn't understand, and looking back, I was still dealing with those symptoms of detachment, and I didn't know what to do, and I had no emotional attachment to this child. I did have this part of me that I could solve problems that were linear and that were solvable and containable. So my healing involved having a support system, listening to the experts, and then having something that helped keep me grounded in who I was. But this was not the first time that I had experienced a mental health crisis. A year before, I had a severe year prior to his birth, I had a severe nervous breakdown and almost took my life. And at the time when that moment happened, I didn't really recognize what was happening. Like I knew, but I didn't know. It was an out-of-body experience. And fortunately, I had an appointment at the VA, and it wasn't a mental health appointment. It was for lupus. It was rheumatology, and they had enough training to know that something was wrong, and called in somebody, and then I had somebody to check in with every month. And I bring that up because these people are trained to know and to recognize the signs. And there are many signs, and it's the same signs that my husband recognized, that the University of Utah recognized when my child was born. And the signs are very physical, like your pupils change, the muscles in your face change. And if someone's not trained to recognize these things, they're not going to catch that. And those professionals at the Veterans Hospital, they don't know, but they could very well have saved a life that day because they were trained. And so, yes, we want to have resources for women to take advantage of. Yes, we want to extend that period of time for them to get care. But if they're not in the right space of mind, if they don't know what's happening, they won't take advantage of those because they don't know what, they don't understand. And so as we start to talk about policies, what we cannot overlook is to prepare the communities surrounding these families, the fathers, the surrounding extended families in the community, and our employers. Because if people around that mother don't know what to recognize, it could be so small. Because I went to that appointment, it was like, oh, I'm doing okay, I'm fine, I'm a little off. But those experts knew something's not right. And so part of our policy, we cannot forget to prepare our communities, because as we all know, a family is raised, a child is raised by a community. A mother, first-time mother, is raised by a community. So please, I ask policymakers not to overlook that element of better equipping the support system around that mother. Thank you.
Wow, Caitlin and Summer, thank you so much for your voice and your vulnerability. It's right here. Okay, following last year's moving moment of recognition, we are continuing the tradition of holding a moment of silence for the many moms, parents, and families who have experienced or are currently experiencing the many difficulties associated with reproductive care. But first, I'd like to introduce you to the blue dot while my colleagues pass out blue hearts. The blue dot was created by a mom who suffered from postpartum anxiety with her third child and wanted to find a way to let other moms know that they were not alone. The symbol was a subtle image of a blue dot and a silver lining to illustrate hope. The symbol was selected by the former National Coalition for Maternal Mental Health after one of its member organizations, Postpartum Support International, hosted a contest to seek symbol ideas. The symbol is now being used in multiple ways to promote awareness and solidarity. In 2017, the rights to the blue dot were signed over to the advocacy organization 2020 Mom to further promote the symbol through Maternal Mental Health Awareness Week and strategic partnerships. In 2017, the color of the dot also was changed from baby blue to robin's egg blue to signify reproductive mental health. The blue dot circle may be used by anyone to promote awareness of these disorders. If you are a survivor mother or are honoring the loss of a loved one, either from pregnancy and infant loss or maternal mental illness, we invite you to display your blue heart. Those participating via Zoom are welcome to turn on their cameras and share a heart emoji so that you can be recognized. Instructions are available in a Zoom chat. Thank you. PSI Utah has two notable events coming up in the next month that we would like to share with you. First, the Moms Club of Sandy is holding a fundraiser in behalf of Reach Counseling. The fundraiser will be on June 4th at Auntie Ray's Suites to raise funds for mothers in need of financial assistance for counseling. Distinguished guests include Spider-Man, Wonder Woman, Mirabelle, Elsa, and Rapunzel. Tickets can be purchased in advance from Moms Club of Sandy or PSI Utah. Second, our annual Climb Out of the Darkness fundraising and awareness event will be held at Sugar House Park on Saturday, June 25th. We express our sincerest gratitude to Maya Les for leading this year's event. Hi, Maya, will you wave at us? Hi, thank you. For more information about PSI Utah's upcoming events, we invite you to please visit psiutah.org/events. Now, Jessie Mandel, the Policy Committee's third co-chair, will now provide us with a brief policy wrap-up.
Thank you, Heather. And thank you all. Summer, you pretty much summed up my policy. But I do want to highlight a few because we are the policy committee and we celebrate the investments that Utah has already made in maternal mental health, thanks to many in this room. And we recognize that the policies and investments that we make as a state can help us reach all corners and all women, all men, all communities, so that no one has to suffer in silence alone. The policies that we adopt and enact make a difference for so many in our state. And so there are several we want to lift up today as a committee because we know they make a difference. They know, and they will reach more people that currently are suffering in silence. First, we want to emphasize the importance of affordable mental and physical health insurance. That is foundational to everything that we've been hearing and talking about today. And yet there are still so many in our state who lose their benefits postpartum or are shut out of prenatal coverage entirely and unable to access care, prenatal through postpartum coverage. We have to do better. No woman should be denied coverage or care because of their race, their ethnicity, their immigration status, or where they live in our state. We can do better for so many in our state, and we can address those policy gaps now. Second is screening. We are doing a lot more screening than we were a few years ago, but we have a ways to go, especially screening earlier on. The earlier we screen, we catch more people that might be at risk for postpartum depression or anxiety after they give birth. But too many are not being reached, and we can increase and expand and strengthen our screening across the state, across our healthcare systems. And we have the policy tools available to do that now. Third is to invest in our maternal mental health specialists, our workforce. As we heard today, there are so many in our state that we're able to see the signs. These are our OBGYNs, our pediatricians, our providers. These are our mental health specialists, of course, but these are also our community health workers, our doulas, our home visitors. These are women and men and individuals in our state that can reach people where they're at, and they can help women in need. And if we invest in them now, and if we think creatively and innovatively around how we can reimburse women and how we can strengthen that workforce, we'll be better off down the line. We have those tools available to us now. We just need to make those policy investments and adopt those policies for that workforce. And also, let's not forget our telehealth opportunities too, because we know that we've made advancements during the pandemic. Let's not give up on that. Let's keep doing the work there so that we can reach the rural corners of our state. And fourth, we heard about this new fabulous hotline. We have our state investment in maternalmentalhealth.utah.gov, which is an incredible referral website. Let's lift up and make sure that we continue to strengthen and invest and increase the awareness around our existing infrastructure and resources that we've already started. We have more that we can do there to get the word out, more that we can do to increase awareness. It's so critical to keep going in that direction because we've done some amazing work already, and I know that we're going to keep doing great work. So those are a few of the policies that I want to highlight for our legislators and our state leaders, but also, as we will hear from a moment from Gabe, we all have a role to play. Summer, I appreciate what you said. This is a community effort, and the more that we all work together to see the signs, to share resources, and to tell people they're not alone, the better off we'll be for all families and communities in our state. Thank you.
Thank you, Jessie, and thank you so much to all of our speakers today. We still have a lot of work to do to reduce the disparities in maternal mental health, particularly for women of color in our state. And as Ashley so aptly brought to the forefront, that this isn't happening in a vacuum. People are experiencing barriers like white supremacy that impact the ability to treat maternal mental health. With supportive policies and strengthened system supports, we'll be able to provide families with the resources they need. We are so fortunate to have legislative champions who've worked hard to create policies and secure critical maternal mental health funding. You've heard about the successes and resources that make Utah a leader in addressing maternal mental health, and you also heard about the importance of continuing to invest in resources so we can strengthen our policies, develop stronger system level supports, and save lives. The speaker's remarks today shined a light on this very real issue that affects so many families. Thank you so much for coming today. We will now receive questions. If you're not able to ask a question right now, but you want to follow up with some of our speakers or other experts who are available to speak, you can reach out to Priscilla Roundtree, whose contact information is on the press release. But if you have questions right now, we will take questions. And I can't see if there are any questions on Zoom. So Kristen gave me a question. Oh, there is a question. Yes.
I appreciate this announcement still so touched about how speakers mentioned their sufferings while we are young. I have a question just the first slide. I just have to think about like the huge increase of anxiety for pregnant women before the pregnancy. It's like a rise from 12% to more than 30%. It's huge gap. I was wondering what kind of factors that make them have more anxiety just for 8 years, but just made them more anxious before that.
Yeah, thank you so much. The question is referring to the PRAMS data about the increase in maternal anxiety. And we have online Nicole Stone, who can speak to that.
Hi, I can speak to that, but I'm so sorry from being where I'm at. I couldn't hear the question.
Okay, the question was about the increase in maternal anxiety and what are some of the factors that have led to that?
Well, we've been collecting the data for several years, and it's difficult to say from our survey what are all the factors, but we know that anxiety has gotten a lot more attention in the last few years. We think it's gotten, I think more people are likely to answer the question that they are, to not be so stigmatized by it, so that they will, they understand what anxiety is a little better. So when we asked the question on the survey, I think in years past, people were more, a little, less likely to answer yes, they do have it. And over time with the attention like today's event, that moms are more likely to say, yes, I did experience it. That's one factor. And we know that with 2020, we had some increase with the pandemic. So we're looking at that data. But overall, I think that a big part of the increase is just awareness of it. I think it's always been there.
Thank you. Any other questions? Okay, well, if you have questions after the event, please reach out to us. Thank you so much for coming today to join us to commemorate Governor Cox marking May 22 as Maternal Mental Health Awareness Month in Utah. Have a wonderful day, everybody.